¿Qué tal? Muy buenos días.
Hello, good morning, good afternoon, and thank you for joining us on this um, press briefing in the region of the Americas of PAHO. I am Sebastián Oliel from the Department of the Communications of PAHO, and the session will last about an hour. We have received your questions on email, and you will be able to ask them live and through the chat and through the Q&A button. Please always remember to include your name and medium when you send your questions also. We have simultaneous interpretation into English, French, Portuguese, and Spanish, and you can opt for any of the languages using your interpretation button. Today, Dr. Carissa Etienne, Director of the Pan American Health Organization, will talk about the COVID-19, the evolution in the Americas, and what is the situation, and taking into consideration the seasonal changes, summer in the north, winter in the south, and hurricane season. We have with Dr. Etienne, Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Cito Gartis, Director of the Department of Health Emergencies, and also Dr. Jairo Mende, advisor on emerging viral diseases of PAHO. Now I invite Dr. Etienne to share with us her remarks for today.
Good morning to each of you. Thank you for joining today's press briefing. Last week, the Americas reported 1.1 million new COVID infections and 30,000 COVID-related deaths in our region, bringing our total case count to more than 72 million and deaths to nearly 1.9 million. These are staggering numbers when you consider that at this time last year, the entire world had reported 10 million COVID-19 cases and 500,000 deaths. In the months since, this virus has touched every corner of the globe and changed the course of history. And while we are seeing some reprieve from the virus in countries in the Northern Hemisphere, for most countries in our region, the end remains a distant future. In North America, cases are declining across the United States, Canada, and Mexico, although a few Mexican states continue to report a rise in new infections. Many Central American countries like Belize, Panama, and Guatemala have registered an uptick in new infections in certain departments. And in the Caribbean, Cuba, the Dominican Republic, and St. Kitts and Nevis are seeing cases increase. The situation in Haiti is also worsening as cases are climbing across the country and some hospitals are filling up. Cases are still rising in many South American countries like Colombia, Brazil, Bolivia, and Uruguay, and hospitals are challenged to further expand ICU capacities. And while infections are going down in Argentina, cases remain high. Disruptions to essential health services are still widespread across the region, with 29 countries reporting disruptions to almost half of all services. Despite this worrisome picture, just 1 in 10 people in Latin America and the Caribbean have been fully vaccinated against COVID-19, an unacceptable situation. Over the weekend, PAHO helped to deliver 1.5 million doses of mRNA vaccine that arrived in Honduras as part of the US government's commitment to sharing surplus doses with countries in our region. And we expect more than 20 million doses to be delivered by the United States to countries in our region over the coming days. As countries across the region work to contain the spread of COVID-19, they must also begin planning for another challenge: seasonal weather. First, let's talk about summer travel and its potential impact on transmission. With children on vacation, many parents face important choices of how to make the most of these summer months. As more people are vaccinated in the Northern Hemisphere, movement restrictions are lifted and travel destinations reopen for tourists. And many families may be considering booking summer vacations. We must remember, however, that while vaccines protect us from the worst of this virus, even those who are vaccinated can become sick and spread COVID. Given the significant gaps in vaccine coverage and the still imminent risk of infection, now may not be the ideal time for travel, especially in places with active outbreaks or where hospital capacity may be limited. The arrival of summer also marks the beginning of the hurricane season, and this year's hurricane season arrives during worsening outbreaks in the Caribbean and Central America, making storm preparations especially vital. Over the last 5 years, the Americas have witnessed over 550 extreme weather events impacting more than 190 million people. And the potential for devastation is even higher in the context of a pandemic. Mitigating risks starts with having effective alert systems so people know when it's safe to stay home and when it's better to evacuate. Countries should also consider outfitting hospitals and expanding shelters to reduce the potential for transmission, including among family members, since social distancing and proper ventilation will become difficult in the context of a storm. Now is the time to bolster coordination among the public health, civil protection, and emergency teams that could be called on to act in the event of a storm. Stocking up on supplies is also key, so first responders have the proper protective equipment and supplies to safely treat patients. Further south, we must prepare for the risks brought by cold weather. During last year's winter and flu season, mask mandates were in order and stay-at-home measures were underway in many countries of the Southern Hemisphere. These measures help not only to drive COVID infections down, but to almost halt the spread of seasonal flu, a phenomenon that we had never seen before. This year's flu season arrives at a time when COVID infections are exponentially higher, yet public health measures are much less strict. It is no surprise that we've already started to see a return of infections like respiratory syncytial virus among children. Now more than ever, countries must bolster their surveillance systems to monitor the spread of respiratory viruses. Last year's experience also proves the importance of public health and hygiene measures like hand washing and mask wearing in limiting the spread of infections. We also learned the value of protecting the most vulnerable. So we urge countries to consider leveraging existing vaccination programs to protect those at highest risk from both the flu and COVID. More than 13 countries in our region have already started seasonal influenza vaccine campaigns, and over 80 million people have already been protected. But we still have a lot to do to limit transmission of COVID and other respiratory diseases. In closing, I want to emphasize that while seasonal changes will bring new challenges to our COVID response, these are risks that we know how to prepare for. We know that it takes what it takes to stop COVID through effective public health measures. We must have the willpower and commitment to embrace them, especially as vaccine supplies continue to lag behind. Our region is resilient and is long known for the values of Pan-Americanism and solidarity. PAHO remains committed to leveraging our collective resources to ensure that we see this pandemic through towards recovery and rebuilding. Thank you.
Muchas gracias, doctora Etienne. Vamos a pasar ahora entonces a responder
Thank you, Dr. Etienne. Now we will go to the questions that we have received through email and that we are receiving through the Q&A. And please write your questions as we speak and include your name and medium. First question that we have is from Belisa Godinho from W Magazine in English, and it reads
mutation being monitored in the region. Do current inoculated vaccines prevent new virus mutations? Doctora Etienne.
Let me thank you for this question. And permit me to start by emphasizing that so far PAHO has found that the impact of variants of concern on the effectiveness of vaccines for COVID-19 has been minimal. We have been looking closely at this since June of 2020, when we created a genomic surveillance regional network that was designed to detect and monitor all new and emerging variants of that virus that causes COVID-19. At least 23 countries and territories participate in this network, including 6 officially designated sequencing laboratories in Brazil, Chile, Panama, Mexico, Trinidad and Tobago, and the United States CDC in Atlanta. So as a result of these efforts, more than 52,000 viral sequences from Latin America and the Caribbean have been shared in global databases. This PAHO initiative has enabled the detection of all variants of concern, including the Alpha, the Beta, the Gamma, and the Delta variants. In the PAHO region, 43 countries and territories have reported cases of the Alpha variant. 18 countries have reported cases of the Beta variant. 29 countries have reported cases of the Gamma variant. And cases of the Delta variant have been detected in Argentina, Aruba, Brazil, Canada, Chile, French Guiana, Guadeloupe, Martinique, Mexico, Puerto Rico, United States of America, Barbados, Peru, and St. Martin. Let me assure you that we continue to closely monitor these, both through the country surveillance systems and the official international health regulation channels. We are confident that the vaccines that are approved for COVID-19 work and are already preventing countless hospitals and deaths, that those are effective. However, no vaccine is 100% effective. So there will be a few cases even among the vaccinated. And we do expect that. This is not a surprise. But still, the public health impact of vaccination is undeniable. And we are seeing it in places with high coverage. As more people get vaccinated, fewer fall severely ill. And eventually, this will have an impact on transmission, keeping us all safe. So currently, very few places are benefiting from the full potential of vaccines, as there is a huge access gap in our region. As I have said before, this is unacceptable. And the emergence of variants makes it even more urgent that we accelerate supply to the places with the highest transmission. While we work towards expanding coverage, it is crucial that public health measures to control the transmission of the virus continue. These measures also work regardless of the variant, alpha, beta, gamma, or delta. The more the virus is transmitted, the more likely it is that further changes and variants appear, making it important to continue all the known ways to combat the spread of this virus. And that is regardless of the variants. And we need to do that until we are able to vaccinate a majority of our population. Over.
Muchas gracias, doctora Etienne.
Thank you, Dr. Etienne. Now we have several questions that we have received and continue to receive about the variants, especially the Delta. We have questions from Inés Capdevila from La Nación in Argentina, Alejandro Rincón Moreno from EFE, Verifica Tania Smith Cartwright from the Tribune in Bahamas, also on the chat. Karina from the Wall Street Journal. And Ines asks, in what countries have you recorded the largest incidence of the Delta variants? Could this become the preponderant variant in the region? Alejandro asks, where does the Delta plus variant come from? When was it detected, and how does it differ from the regular Delta variant? And for how long will this variant, for how long will it prolong the health emergency? Tanya wants to know if it's the prevalent variant in the Bahamas, the Delta. And this is a question from Tanya Smith Cartwright from Nassau, the Tribune. And is this a threat in our region? So, Dr. Mendez, yes, thank you very much for your questions. I'm going to try and answer them all together. First of all, and as Dr. Etienne mentioned, the Delta variant has been detected in our region. However, to this point, it has been mainly linked to cases of travelers, and community transmission continues to be limited, whereas there are other variants which are the ones that are more widespread. It's hard to predict what will be the impact of the Delta variant in our region. Variants such as Alpha, which has a high level of transmission, and it entered our region, and they predominated just in a transient manner in some countries, and they were rapidly replaced by others, such as Gamma or the Lambda, which is C37, also called C37. As Dr. Etienne was saying, control measures in public health should be focused on decreasing transmission regardless of what the variant is concerned, using all the available tools that have shown to have effectiveness, including, of course, the use of mass social distancing and vaccination whenever it is available. Regarding the question of the Delta plus variant, it's a very good question to clarify some points. This variant has been documented in samples collected since October 2020 in India. It has been detected in about 95 countries since. This variant was defined as a variant of concern, and it's called Delta. However, there is no such thing as Delta Plus. Delta Plus was like a moniker that started being used in a non-official manner in some media to refer to some additional changes that occur within the same variant that can generate some subtle modifications on some of the proteins, the viral proteins. But it continues to be Delta, and that's its name. Delta variant. That is the name. There is no such thing as Delta Plus. There is the Delta variant. Regarding this variant, in fact, we've seen that it's as up to 1.2 times more transmissible as compared to others. But this is not the only factor involved in the infection and epidemiology of the virus. All measures of public health control have been effective to decrease transmission. This is why we insist on this point. It's important that regardless of what variant is concerned, we need to keep those control measures regarding the risk in the Americas, specifically regarding the Delta variant. The emergency and the introduction of variants is something normal. It is expected because that's part of the evolution of the virus. And it has been happening globally from the very first few months of the pandemic. Of course, there's the risk that the Delta variant or other variants become widespread. However, public health control measures for any variants continue to be the same. And therefore, this is where we should focus our efforts to stop transmission. Also, we need to strengthen genomic surveillance, which is articulated with epidemiological surveillance that will allow us to demonstrate not only that there are changes in the clinical form of the disease as well as changes in the variants, and this can help us with respect to the epidemiology of the virus. Regarding the Bahamas question,
So far, we don't have any evidence of the circulation of the Delta variant in the Bahamas. Nevertheless, I would like to mention that the Bahamas is participating in the PAHO Genomic Surveillance Network, and many samples are sequenced regularly. We're going to have more information during the coming weeks, as some samples actually were sent to our collaborating centers for sequencing during the last week. So I hope I answered your question. Muchas gracias y vuelvo a ti, Sebastián.
thank you very much. Over to you, Sebastian. Thank you very much, Dr. Mendez, for answering all the questions. Next question is from Emilia Wexler from Clarín in Argentina. So to prevent or delay the um, entering of the Delta variant, does PAHO recommend the total closure of borders or isolation in hotels by travelers going back to the country? For Dr. Ugarte, yeah, thank you. Depending on the risk of transmission in the country, authorities, of course, may make their decisions based on the capacity of the health system to do early detection of cases, to isolate suspects, to quarantine them and quarantine the contacts, and for treating patients in the different levels of the health system, especially taking into account the availability of hospitalization beds and ICU beds. So it is necessary to update the risk assessment, and based on that risk assessment, one can make decisions, and these decisions change. You mentioned, yes, complete closure of borders to prevent international travelers from coming and going. Another option is closing doing a closure and limiting access from certain specific countries, considering that there is a higher proportion of the Delta variant circulating in those countries or other variants circulating in certain countries. And other measures can also be taken, for instance, allowing access of travelers. However, having surveillance having like a surveilled isolation or quarantine. And in some cases, there can be just surveillance and reporting of passengers that arrive in the country. Taking into account what the situation is in several countries and how things change with the variants, especially the variants of concern, and considering that this is a shared responsibility, we uh, make an appeal to countries who have a high proportion of circulating variants of these kinds to make a decision either to significantly limit travel from their countries to other countries or even really close down their borders. But this is a decision which needs to be made on both sides, both the country of origin and the country of destination. In any case, limiting or closing borders is not guarantee that the virus won't make it into the country. Frequently, the variant has already made it into the country. So the greatest challenge is to take all the measures for early circulation and prevent the further transmission of the variants in our countries. As Jario said, many of the countries already have the different variants present in them. Thank you. Thank you, Dr. Ugarte. There are some other questions from Emilia Wexler, from Clarín, and from uh, Blanca Valadez from Milenio, Mexico. Does PAHO support the use of Cancino as a second dose of Sputnik? Also, another question about Cancino. Why has it been disqualified by WHO? What are its limiting factor, or the limiting factors for this? And when do you recommend to give the second dose of AstraZeneca? Do you need to wait 3 months? Thank you for your questions. Let me answer the last one first. The group that provides the recommendations to WHO, which is the SAGE group, a group of experts, we follow these recommendations issued by the SAGE group. The recommendations for AstraZeneca is that the second dose may be given from so within 8 to 12 weeks after the first, the recommendation of using the limiting period of 12 weeks or 3 months can facilitate access for the people, because then the country is able to administer more doses to more people. All studies are uh, clear that it doesn't change protection. On the contrary, some studies have suggested that the more you use the longer the interval. So if you go all the way to the 12-week period, then you will have maximum protection. So uh, 3 months is good. On the contrary, it may be optimum to wait 3 months, and many countries are using it. Regarding the Cancino and Sputnik, the revolving fund of vaccines of PAHO, which together with UNICEF purchases vaccines for the region of the Americas, in representation of the COVAX facility, we only buy vaccines that have been granted the uh, emergency use license from WHO. Sputnik was in the process, but some problems were identified in some places, in some plants, in some of the sites where the Sputnik vaccine is manufactured. When the manufacturer makes the changes and is able to give all the requested information, they will continue. But to this point, the Sputnik vaccine has not been granted the emergency use license. The Cancino vaccine has a more recent process. WHO has not disqualified it or qualified it yet. The Cancino vaccine has recently just started the process of qualification. It started in June, just this month. So there's some inspection visits to the plant. All the documents need to be reviewed and assessed. And once WHO has finished doing all the evaluations, both for Sputnik and Cancino, we cannot begin to purchase those two vaccines because we don't have enough information. We need to wait until the process is fully completed before we can purchase or make any other statements. Thank you. Thank you, Dr. Barboso. Now I would like to ask a question from Kadib Joseph.
And Observer Media in Antigua y Barbuda. Kadim, you have the floor.
Thank you so much, Sebastian, and thanks to the panel for hosting me this morning. Antigua and Barbuda has had zero active COVID-19 cases in recent weeks, with tourism arrivals set to pick up in just a few weeks here in Antigua and across the region via cruise and air. What advice does PAHO have for limiting the risk of introducing new infections into the population? And what does PAHO make of Florida going against having proof of vaccinations for cruise tourists?
Gracias, Kadim. Y preguntas similares en el chat nos hacen Rachel Scott del Nassau Guardian en Bahamas y también Jasmine Brown de Our News en Bahamas. Doctor Ugarte, ¿podría contestar?
Dr. Ugarte, could you please answer?
Pleasure. Thank you for those questions. And this is very timely also. I would like to begin highlighting that if the decision to open to tourism has been made by the authorities, it is understood that it has been made according to the risk analysis and risk assessments, or also, and as a conclusion, as a risk tolerance level of the country in the context of where the introduction or further local transmission and spread cannot be eliminated. I would like to emphasize this. Okay, the importation of cases and further spread cannot be eliminated. It can be reduced. So in that regards, authorities must have put in place measures to minimize the risk of local spread by early detection, as we said, isolation of suspected cases, quarantine of contacts, and also early treatment of the patients and identification, and of course the use of personal protective equipment, the use of masks, for example, and information to the public, information to the tourists, adoption, for example, of physical distancing, applying to both the tourists but also the local population. And the decision of the Florida authorities of Florida against the proof of vaccination for cruise ship passengers is fully aligned with what PAHO and WHO have been recommending. Uh, we do not recommend the requisite of proof of vaccination to initiate an international travel. There are several reasons for that. One is the low availability of vaccines in many countries. The other one is that we know that the vaccines cannot prevent the infection, although several reports show that it reduces the transmission, and particularly on boarding a conveyance undertaking an international voyage, at present there is insufficient information that is available about the transmission among the vaccinated people, and there are, as I mentioned, several ethical considerations into play regarding the accessibility of vaccines. Lastly, as we said before in these press conferences, resuming cruise ships traffic requires the utmost caution because the dynamic of the spread of the virus on cruise ships is still not fully understood. So the countries that are receiving cruise ships on their shores must be cautious for the importation, early detection, but also on the potential spread of the virus among the community. And those decisions must be taken according to the risk assessment, as we already mentioned. Thank you.
Gracias, doctor. La próxima pregunta viene
Thank you, doctor. The next question is from the Q&A from Gerson Conyabe from El Comercio in Peru. And he's saying about 400,000 individuals have not received the second dose of the vaccine in Peru. What is the impact of this situation in Peru given the circulation of the variant, in particular Delta? Dr. Barbosa. Thank you for the question. This is a concern not only for Delta, but for the original virus and also for the other variants. If it is a two-dose vaccine, the person is only protected when the two vaccines are administered, and this is not only in Peru, but also in other countries of Latin America. We are receiving the information that there is a gap between the individuals that received the first vaccine and those that received the second one. It is very important there to see the role of primary health care to identify who those individuals are, why they did not go back, whether they need more information, whether they have some difficulties to go to the clinic to receive
the dose, because vaccination is only complete once the 2 doses have been administered. So it is key to receive both. Barriers need to be identified and what needs to be done in each location to complete protection. Thank you. Thank you, Doctor. The next question is Guillaume Long from the Financial Times. And the question is, what is known about the Lambda variant? How does it compare to other variants in terms of transmission and lethality? And also whether its alleged origin in Peru explains the high figures of COVID in that country during the pandemic, and also what other countries of Latin America have detected this variant and how efficient are vaccines against this variant. Dr. Mendez, thank you very much for that question in relation with this variant that has been recently identified as a variant of interest, the Lambda variant. The first detection was in November, December 2020, and the oldest detections have been in Peru. So far, it has been detected in 8 countries of Latin America and the Caribbean. However, this detection has been sporadic. Most countries have had an increase of community transmission, such as in Peru, where it is 2% of the sequences sampled between May and June had it, and in Chile also, where it was detected in most of the samples detected between May and June. We also saw it in Argentina, but there the transmission was in less than 4% of the sequences, and in Argentina there are gamma and other variants that are prevalent. There is no evidence so far to infer a more aggressive behavior with this Lambda variant. It is quite likely that there is increased transmission capability. This is a phenomenon that has not been properly assessed. Therefore, we cannot compare against other variants such as Gamma or Delta. Once again, the epidemiology of the virus and the increase in the number of cases are linked to several factors, not only the capacity the virus has for transmission. We need to insist that we need to focus on diminishing transmission regardless of the circulating variant by using all of the tools that have proven to be effective. And all of those measures in combination with vaccination will be effective. So far, once again, we still have some studies to complete. We have no evidence, no reason to think that vaccines are not working or covering against this and all of the variants. So all in all, as it was said at the beginning, vaccination continues to be one of the most powerful tools we have, as the director said at the outset, to mitigate the pandemic. Thank you very much. The next question, we are going to have the Italian journalist Lucia Capute from the Avvenire Journal. Please go ahead. You have the floor. We cannot hear you yet. I think we're having a technical problem. Then I am going to read the question that was sent to us by Lucia. She's asking about the situation of the pandemic in Latin America and why the Latin America became the epicenter of the pandemic, and whether inequity had anything to do with this. Dr. Ugarte, could you please address this question? Thank you, Sebastian. First, I would like to say that we have used epicenter to highlight the presence of a higher number of cases in Latin America and the Caribbean. In that regard, we have used the term not as the place from which cases are spread to the rest of the world. And we have seen that simultaneously in several regions of our own hemisphere, in North America, in Europe, Asia, Africa, and in other places. There are areas that do have a significant increase in the number of cases. But proportionally in our region and based on our analysis, one of the reasons is inequality and the informal nature of the economy, the difficulties in wearing a mask, in implementing public health measures, when many individuals rely on the daily income to be able to support their families. And those countries that had a full lockdown for a very long period were unable to maintain the lockdown. And you need to remember that during those periods, cases were quite few. But immediately after, and once international travel was again an option, including the low availability of masks and PPE for public health workers, all of this had a significant impact on the region. So compared to other regions, we are very impacted, and the reports of new cases and new deaths in our region are high as compared to the rest of the world. So we continue to be in a period of very high transmission, and the response to COVID-19 is a priority, and we continue to work tirelessly to obtain more vaccines so that we can attain herd immunity and for the population to be protected. In the meantime, we are going to have sporadic outbreaks alternating with low transmission periods, and we are going to see these in several countries, even in those that are increasing vaccination, because all in all, the reduction in protection measures does have an impact on virus transmission. Thank you. Thank you, doctor. We have several questions related to the Cuban vaccines and Venezuela. I will read two of them. One from by Nestor Aguilera, who is with La Voz in, and the question is, what is PAHO's opinion about Cuba government's announcement in connection with the Abdala vaccine and the efficacy that it offers of 92.28%, and also what are what is the outlook in terms of its assistance to in this fight against COVID-19? And another question through the through the chat: does PAHO recommend the use of the vaccine candidate Abdala, such as what we see in Venezuela? Dr. Barbosa, thank you for the questions. I am certain that there are many questions about the new vaccines, but PAHO appreciates all of the efforts by countries in Latin America to develop the vaccines, the effort carried out by Cuba and other countries in the region are welcome, because our region, unfortunately, Latin America and the Caribbean, is vulnerable, and we have a trend. Usually we rely on the importation of PPE and vaccines, and we need to overcome this. So first of all, it is important to have a project for the development of vaccines in the region. And secondly, PAHO does not authorize or endorse vaccines. What happens in terms of vaccines is that the vaccine revolving fund with PAHO can only request vaccines that are authorized to be used for emergencies by WHO. So without this assessment by WHO, we cannot include this vaccine as part of the acquisitions of the revolving fund, and UNICEF cannot include these vaccines in this. So the vaccines that are not authorized cannot participate in the COVAX mechanism. So I think it would be very important for the producers of the Abdala vaccine to complete all of the trials results 1, 2, and 3 and publish all of these in the scientific journals so that the scientific community can become familiar with this data. And second, if they're interested in offering this for the COVAX mechanism, for the COVAX facility, and the COVAX facility welcomes all of the vaccines, they need to request the authorization for emergency use by WHO, and to that end, it will be necessary to have an inspection to certify that production is in keeping with the best manufacturing practices, and a full evaluation and a detailed assessment of all of the clinical trials 1, 2, and 3. So the decision to use a vaccine is a decision to be made by the sovereign. The country can use whatever it desires to use, but so as not to have any problems, or so as to avoid any sort of problems in general, we recommend for the public authorities to show how the assessment process was conducted and also how the authorization was granted. And we think that this is important to guarantee that the communities, the individuals, are familiar with what is going on. At this point in time, we are going to look at the publication and the review of the data by the producer, who will be requesting the inclusion of the vaccine as a vaccine that may be authorized for emergency. At that point, right now, there is no authorization. So this is again an invitation to publish the data and request that process to be carried out by WHO. Thank you. Thank you, doctor. We're going now to move on to a question by Melina Ochoa from Mexico with UNO TV, who says that Mexico is reporting the accelerated transmission of the Delta variant. Some of the states have had an outbreak and or a resurgence of the outbreaks, and is there any information on this? First of all, I'd like to mention, this is Dr. Mendez, that Mexico has one of the most solid surveillance networks, and this is one of the reference labs for PAHO. And due to this capability, Mexico has been able to detect more than 15 variants that have been co-circulating throughout the country, including alpha, beta, and gamma. The Delta variant in particular was detected a short while ago, and it was detected in 3 states, Quintana Roo, Baja California, and Mexico City. Mexico City is the place where it has spread the most, and we have seen also how this has replaced other 3 variants that had been there before. Mexico has maintained a very active surveillance together with epidemiological surveillance, and so that they can report any increase in the number of cases or in the disease that may have a negative impact on health. This is what I could say at this point in time about the situation in Mexico. Thank you. Thank you, doctor. The next question is by Diego Arias with Telemundo in English, and it reads,
for wearing masks indoors, given the spread of the Delta COVID variants. If you can elaborate what's that recommendation, Dr. Barbosa?
Thank you for this question. I think that's very important to have this kind of a question, because we have a very different situation in the countries worldwide. We have countries that are getting more than 50% of their population vaccinated, while other countries are still struggling to get 1 or 2% of their population vaccinated. We have countries that have controlled the transmission, so the transmission is decreasing in a very sustainable way in the last 8-10 weeks, while other countries are still facing a very important increase in the number of cases and deaths related to COVID-19. So the recommendation of WHO, that we fully agree, is that we cannot think that starting the vaccination is equal to let's release all the public health measures. This is not the way that vaccines can work. To get the control of the transmission, we probably will need a vaccination coverage around 70% of the population. So while we are increasing the vaccination, it's very important that all the public health measures that we know are very effective to control the transmission needs to be used. Of course, that a national authority, a local authority can make an assessment about the specific situation in that city, state, province, and to adapt the recommendation. But in general, for every country, it's very important to keep wearing masks, keeping social physical distancing, and avoiding crowded and closed spaces. Even people that receive the vaccine needs to keep these measures because no vaccine, and this is not only COVID-19 vaccines, but no vaccines for every disease is 100% effective. So even people vaccinated, if in the city that you live, in the state of you live, in the country that you live, we have a strong community transmission, you need to keep wearing masks. Thank you.
Muchas gracias, doctor Barbosa.
Thank you very much, Dr. Barbosa. The next question is by Blanca Valadez from Mexico and Melina Ochoa from Uno TV in Mexico are similar in connection with the situation in Mexico, the increase in the number of cases, and whether PAHO sees an accelerated increase in the number of cases, and what states have reported more cases, and whether we are seeing a third wave. Dr. Ugarte, yes, we have seen sustained increases or the reporting of new cases of COVID-19 in Mexico over the last couple of weeks. And due to that, the government has decided to move several countries, several states to orange. One is already in red. It's quite likely that others may move to red. And the places where we have seen the most significant increase are Quintana Roo, where Cancun is, also Baja California South, and also we have seen an increase in the number of cases in Mexico City. Over the last week, for example, twice as many cases as compared to what had been reported a week before were reported. So even though the numbers or the proportions are significant, we are still very far from the number of cases we had in January this year when the pandemic was at its worst. It does not mean, though, that we should reduce public health measures. Quite the contrary. This is an early sign that it is necessary to implement all of the measures, including more active case detection and also the isolation of suspected cases, contact quarantine, and also an increase of the capability that health services have to accept patients. And the surveillance, together with the surveillance of patients, are, as mentioned in this press briefing, as are the necessary steps to contain the pandemic in Mexico and in other countries in the region. Thank you, doctor. The next question is by Chris Vilches from El Comercio in Peru, and he is asking whether vaccinated individuals with Sinopharm should receive a third booster given more contagious variants such as Delta. In Peru, we hear that there is a request to have the third vaccine as a booster with Pfizer rather than Sinopharm. Thank you. We understand that there are several concerns with the new variants, but at the outset, it is important to mention, as we already said here, that protection measures continue to be in force for everyone, for all of the areas. So it is important to maintain all of the measures. Secondly, the Strategic Advisory Group on Vaccines, SAGE, with WHO, reviews on a weekly basis all of the evidence that we have on the efficacy of the vaccines for the new variants, and also the possibility to combine doses, and also when there is evidence, sufficient evidence, a new recommendation is being issued. So far, there are no recommendations for a third dose because there are variants. We do not have any evidence to justify this. And in a situation of scarcity of vaccines, this may mean that more vulnerable individuals will not receive the dose, the initial dose they need to be protected. So most importantly, we need to guarantee vaccination, and also to guarantee that vaccinated individuals vaccinated with any vaccine in cases of strong virus transmission in their own cities, and also in cases of high transmission as what we see right now in Latin America, they need to continue wearing the masks and also implement other health measures. This seems to be the best recommendation based on the information we have. Thank you very much. We are reaching the end of this press briefing today, and we have several questions related to the announcement and also the shipment of vaccines by the US to countries in the regions. And Cerulean from TPJD2 Radio in St. Martin, and also from Associated Press. They're requesting more information as to the dates and how those vaccines will be delivered through COVAX and PAHO. Dr. Etienne.
And let me thank Stephen and Jasper for this question. I really want to begin by reaffirming our gratitude to the United States for this generous donation that will make a difference in some of the countries that are suffering extreme hardships due to COVID-19. As we have said over again, Latin America and the Caribbean have been the global epicenter of this pandemic since it began. And donations like these are really an effective way to get vaccines that are now unavailable through the market, and to get them into the arms of people that desperately need them now. So really, we are hopeful that these donations and this support will be duplicated by other developed countries so that we can expand the access to vaccines as soon as possible. Working with the COVAX facility, with governments and producers and other partners, we have been able to deliver more than 21 million doses to 31 countries in Latin America and the Caribbean. But the reality is that we still face a glaring gap in access to vaccines. Honduras was the first country to receive doses donated by the US, and that is through COVAX. 1.5 million vaccines, as I said earlier, arrived last Sunday, and millions more are en route to the region to be delivered in the coming days. Approximately 6 million doses have been allocated for South and Central America to more than 15 countries. These include Brazil, Argentina, Colombia, Costa Rica, Peru, Ecuador, Paraguay, Bolivia, Guatemala, El Salvador, Honduras, Panama, Haiti, and other Caribbean community CARICOM countries, and the Dominican Republic. So the PAHO revolving fund, we have been working around the clock with the governments of the US and the recipient country governments, as well as with COVAX, to make sure that these vaccines are received promptly, safely, and are ready to be deployed as soon as possible. You know, the PAHO's revolving fund for more than 40 years has provided access to safe and quality vaccines and vaccine supplies at affordable prices. And we've done that for 42 member states throughout the Americas, and contributing to the sustainability of their national immunization programs, and to the elimination of transmission of many vaccine preventable diseases. So through the revolving fund, PAHO supports logistics and legal issues, as well as serves as a bridge between the suppliers and donors so vaccines are shipped quickly. With COVAX facility, UNICEF, and other partners, we are helping countries prepare and receive COVID-19 vaccines and to deploy them promptly. You need to know that delivering vaccines amid a pandemic is a complex operation. And PAHO is putting its accumulated expertise in the procurement, handling, and technical support to use to help member states access COVID vaccines. In addition to the United States, we are also in conversations with Canada, Spain, and other partners to secure more vaccine donations and to get them to our countries as quickly as possible. The global supply of vaccine is very limited, and donations are our best option in the short term to protect those most vulnerable in Latin America and the Caribbean. Frankly, we've said that before. Access to COVID-19 vaccines should not be a privilege for a few, but a right that we all share. Thank you for joining our press briefing today.
Muchas gracias, doctora Etienne. Ahora sí.
Thank you very much, Dr. Etienne. We have indeed reached the end of today's session. Please remember that you can find more information on COVID-19 on our own webpage, www.paho.org. And let me invite you tomorrow to a live conversation on our social media about variants. And tomorrow at 2 p.m. Washington, D.C. time, we will be having this session with Dr. Mendez Rico and other specialists from the Public Health Institute of Chile. So we will be hosting you tomorrow at 2 p.m. live. Please connect tomorrow so that you can ask questions about variants. So this is all for today. Thank you for being with us, and let's take care. Thank you. Greetings from Washington.